Welcome to the Charting Courses Podcast, a show brought to you by the team at Ventura MedStaff, dedicated to helping traveling medical professionals navigate the world of travel healthcare. Welcome back to the Charting Courses Podcast, the podcast where we help traveling healthcare professionals navigate the world of travel healthcare. I'm your host, Luke.
Brittany.
And today, we're diving into a setting that's becoming more and more popular in the travel world, home health.
Yep. We're talking about what home health assignments actually look like, the biggest benefits, the challenges people don't always expect, and honestly, who this setting is really best for.
Because if you've only worked in a hospital or clinic, home health can feel very different.
Completely different. And not just for therapy either. This applies to nurses too. There are a lot of travelers exploring home health right now because of the flexibility, autonomy, and demand across the country.
So let's start simple. When people hear home health, what does that actually mean in the travel world?
At its core, you're providing care directly in a patient's home instead of a hospital or clinic setting. So, for therapists, that could mean evaluating mobility, safety, balance, strength, all in the patient's real environment. And for nurses, you're often doing things like wound care or medication management, patient education and assessments, really helping patients transition safely and successfully at home.
Which honestly gives you a much more realistic picture of what they're dealing with day to day.
Yeah, definitely. You're not just seeing a patient in a controlled clinical environment for 20 minutes. You're seeing their routines, their support systems, their challenges. A lot of travelers say the relationships feel deeper in home health.
So the big question is, why is home health so popular among travelers?
One of the biggest things we heard was flexibility. Your day usually has a little more independence compared to traditional settings.
Meaning you're not standing at one nurse's station or inside one facility all day.
Right. You're out and about, you're managing your schedule, traveling between patients, and for a lot of travelers, that autonomy is huge.
I could see that being especially appealing for experienced travelers who like a little freedom in their day.
Oh, absolutely. Another thing people love is the variety. Every home is different, every patient situation is different. It keeps the work from feeling repetitive.
And honestly, when I think about it, if you love exploring new areas while traveling, home health gives you a unique perspective of the communities you're working in.
Yes, that came up a lot too. You're outside of a facility bubble and, really get to experience the area you're in.
Let's talk therapy for a second because home health seems to be especially popular for PTs and OTs currently.
Yeah, it really is. A lot of therapists love the opportunity to do one-on-one care. Plus, they love that treatments become incredibly functional in home health.
Can you elaborate on that?
Yeah, so you're helping patients with real life mobility and safety. Instead of practicing stairs in a clinic gym, you're working on their stairs. So instead of talking about fall risks, theoretically, you're seeing the rugs, lighting, or setup that's creating those risks in their own home.
That probably makes progress feel more meaningful too.
Exactly. Therapists often say home health reminds them why they got into healthcare in the first place, because you can directly see the impact on a patient's daily life and their independence.
And for nurses, home health can also offer a very different pace compared to bedside nursing.
Yes, but I do want to mention different doesn't mean easy.
Good distinction.
Yeah, you need strong assessment skills, organization, time management, and communication. You're often working independently, so confidence matters too.
But for nurses who may feel burnt out from hospital environments or done with the hospital politics, this setting can feel really refreshing.
Yeah, exactly. A lot of home health nurses say they appreciate having more one-on-one patient interactions and more time focused on education and outcomes.
Okay, so let's balance it out. What are some things travelers should realistically consider before taking a home health assignment?
Driving. That's the obvious one.
A lot of driving?
Potentially, yes. Your territory can vary a lot depending on the assignment. So some are going to be, more compact and manageable, while others involve more windshield time. But a benefit to the driving is if you're using your own car, you do get mileage reimbursement added onto your paycheck every week.
That's a nice benefit. Thinking about driving around all by themselves, though, and I imagine they really need to be comfortable working independently if they're doing so.
Yeah, they do. And that's probably the biggest thing, right? If you thrive on constant team interaction every minute of the day, home health can feel really isolating at first.
Yeah, you're not walking down the hall asking coworkers questions all day or getting feedback on a treatment plan.
Right. You have support, but your day-to-day workflow is much more self-directed.
So, who do you think tends to thrive in home health?
Definitely people who are adaptable, organized, independent, and relationship driven.
I think I would add on travelers who enjoy problem solving.
Yeah, absolutely. Every environment is different. You have to think critically and adjust in real time.
And honestly, if you like routine and predictability every single day, this setting may feel uncomfortable at first.
But if you enjoy autonomy, flexibility, and building strong patient connections, home health can be incredibly rewarding.
I think one of the coolest takeaways here is that home health really gives travelers another way to adventure.
Definitely. It's not just hospitals anymore. There are so many settings where travelers are needed, and home health continues to grow for both therapy and nursing.
And if someone's curious but a little unsure, that's where having a recruiter really helps.
Yes, your recruiter should be able to answer any questions you may have and help see whether or not home health, aligns with your personality and goals. Because the best setting is really the one that fits you best.
Couldn't agree more, Brittany. If you've been considering a home health assignment, now's a great time to explore it. Whether you're in nursing or therapy, our team can help you learn what opportunities are out there and find a setting that fits your goals and lifestyle. Thanks for listening, and we'll catch you on the next episode. Thank you for listening to the Charting Courses podcast, brought to you by Ventura MedStaff. If you enjoyed this episode, give us a like, share it with your friends, and follow our channel so you never miss an episode.